everybody, I'm Dr. Chris, and today I'm going to talk about the incident involving Bronny James' cardiac arrest last week at basketball practice, why it may have happened, and if there is anything he could have done to prevent it. Let's dive in. First, let's recap what happened in Bronny's case. Bronny James, the son of basketball legend LeBron James, suffered a cardiac arrest during basketball practice with his college team, raising questions about how it's possible for a seemingly healthy 18-year-old to lose heart function. Obviously, it really hits the headlines when something like this happens to somebody famous. But as shocking as it is, unfortunately, stats show us that this does happen. A study by researchers at the University of Washington, first published in the medical journal Circulation in May 2015, found that the rate of sudden cardiac death in NCAA athletes has remained fairly constant over the last 10 years and is approximately 1 in 50,000. This is approximately the same chance as being hit by lightning, winning a medal at the Olympics, or of a meteor striking a specific location on Earth. While rare, these things do in fact happen. It was also found that the highest risk groups included males, black athletes, and basketball players in particular. It is important to note that several scenarios could have played out that resulted in James or any of these other athletes suffering from this life-threatening condition. One possibility is hypertrophic cardiomyopathy, a thickening of the heart muscle that is observed in elite athletes and sometimes in individuals with certain genetic predispositions. Intense physical activity or competitive sports can potentially exacerbate the symptoms of hypertrophic cardiomyopathy, or HCM. You know, since high-level athletes train like this. Okay, I pull up. Okay, I pull up. Or like this. Another potential scenario is commotio cordis, in which a sudden blow to the chest disrupts the cardiac rhythm, leading to cardiac arrest. This was the case with football player Damar Hamlin. Given the nature of the sport, the cause makes sense in his case. Other structural heart abnormalities that have gone undetected. Acute myocarditis, an inflammation of the heart muscle that can lead to abnormal heart rhythms and sudden cardiac arrest. We've seen this as a result of COVID and the COVID vaccine, but in very rare cases. Genetic and non-genetic arrhythmia, an abnormal heart rhythm, which is like a glitch in the system that can cause the heart to stop. As of the filming of this video, the exact cause of James' cardiac arrest has not been disclosed, but we know that he is on the mend. Given what happened, he will likely undergo a medical workup that could include advanced imaging of the heart, rhythmic monitoring, and possibly genetic testing to explore other potential causes before he returns to training and gameplay. Yes, James's incident has prompted speculation from anti-vaccine proponents who have raised doubts about vaccine safety. Both COVID and the COVID vaccine have been shown to cause acute myocarditis in certain instances. The myocarditis caused directly by contracting COVID is worse than the myocarditis brought on by the vaccine. Since the vaccine lowers the likelihood of contracting COVID and thereby lowers the likelihood of developing a more extreme case of myocarditis, there is a delicate balance to strike here. However, it's important to note that the incidence of myocarditis and pericarditis in both cases is rare, with the majority of affected individuals recovering without complications. We know that in terms of health of the population, getting COVID is worse than getting the vaccine. Ideally, we would rather not have to deal with either, but it's the best solution for an unfortunate situation overall. Right now, I want you to think about your health in terms of a layered or stacked effect. A lot of the time, illness or disease happens when a number of negative influences impact the body all at once in a way that it tips beyond the manageable, or what we might term healthy. Because what is health really? What we call sick is usually when our symptoms make it so that we can no longer function normally. Let's get back to our discussion about arrhythmias for a moment. Some cases are passed down genetically, and some occur as a result of structural issues. But this doesn't account for all cases. Yes, there are other factors even, factors that a person can control. For example, Electrolyte imbalances. Abnormal levels of electrolytes in the blood, such as potassium, sodium, and calcium, can disrupt the heart's electrical activity and trigger ventricular arrhythmias. Dehydration in general.
I just really despise the taste of water. It's like slimy nothing.
Caused by inadequate fluid intake.
It's slimy going down my throat.
Excessive sweating due to heat or intense physical activity.
I work out every single day, no matter what. I just bring a coffee to my workout.
Vomiting or diarrhea or excessive alcohol consumption can disrupt the balance of electrolytes in the body.
I'll drink coffee, I'll drink alcohol.
This is particularly a problem for people as they get older, but it is definitely something that athletes of all kinds need to address and pay attention to.
I've ended up in the ER 3 times.
Certain medications, such as some antipsychotics and antibiotics, can increase the risk of ventricular arrhythmias. The use of certain stimulant drugs can in some instances cause heart arrhythmia as well.
Do you take drugs or alcohol?
What is drugs?
But also, and please pay attention here as the use of the following is on the rise, prescribed amphetamines such as Adderall, Concerta, Ritalin, modafinil, and ephedrine, just to name a few. Now, ventricular arrhythmias can vary in severity, with some being relatively benign and others life-threatening. One last point I would like to discuss.
And another thing!
There have been numerous studies investigating the potential link between vitamin D deficiency and heart health. Several studies have suggested an association between low levels of vitamin D and an increased risk of hypertension, cardiovascular disease, stroke, and heart rhythm disorders. Certainly, more research is needed to establish a direct cause and effect relationship here, but from a purely practical standpoint, I don't think it's a bad thing to take precautionary measures in this regard.
Get some sun.
And this goes for everyone, both young and old.
Get some sun.
And I am in no way saying that this is the cause, but it's an interesting fact that young black men seem to be at a higher risk for heart malfunction than other athletes. So while we may not know exactly what happened to Bronny, I think it's important for everyone to recognize the layers that can affect the heart. A person could have unobserved hypertrophic cardiomyopathy, as well as low levels of vitamin D or magnesium to start. They could have taken some kind of pre-workout, could have gone out a few nights before to celebrate for something and drank a little too much. They could also be on some kind of prescription medication, all of which could have created the perfect storm for a heart event to happen. And the vaccine? Well, just another normally insignificant layer. What happened to Bronny James does happen, we just don't typically hear about it. More importantly though, people need to understand that your health or sickness usually presents as a result of numerous stacked or layered factors. If you pile layers of normally benign conditions on top of one another, you could be confronted with a problematic situation. When it comes to your health, a person must pay attention to the details of what they put into their body and what they do to their body in order for the good to outweigh the bad. I hope the best for Bronny in the future. Sounds like he's gonna be okay. I hope you found value in this video. If you did, remember to give it a like and subscribe to the channel if you aren't already. And if you didn't like it, tell me why in the comment section down below. Also remember to check out my online gym, Human 2.0, for free workouts and fitness tips that are structured around injury prevention, mobility training, and just helping you move better in general. Otherwise, as always, that's been a word from Dr. Chris, not your everyday ortho, where we see one, do one, teach one.